Tuberculosis, often called TB, is a serious infection. It's caused by a type of bacteria. This bacteria is called TB, usually affects the lungs, however it can spread to other parts of the body. This includes the kidneys, spine, and even the brain. TB is a contagious disease. This means it can spread from person to person. It's important to diagnose and treat TB early. This helps prevent serious health problems. Early treatment also stops the spread of TB to others. TB symptoms can be tricky. They often develop slowly, making it hard to recognize the disease in its early stages. This slow progression can lead to a delay in seeking medical help, which is why understanding the symptoms is crucial. Sometimes people with TB don't feel sick at first. This is because the bacteria can lie dormant in the body for months or even years without causing any noticeable symptoms. During this latent phase, the person is not contagious. This is called latent TB. People with latent TB infection do not feel sick and do not spread TB bacteria to others. However, if the immune system weakens, the bacteria can become active, leading to active TB disease. When TB is active, it causes noticeable symptoms. These symptoms can vary depending on which part of the body is affected, but the lungs are the most common site of infection. A cough that lasts more than 3 weeks is a key sign. This persistent cough is often accompanied by chest pain and may worsen over time. It's important to pay attention to the duration and severity of the cough. The cough may bring up mucus, sometimes with blood. This is a serious symptom that should not be ignored, as it indicates that the infection is causing damage to the lungs. Other common symptoms include fever, night sweats, and weight loss. These symptoms are often mistaken for other illnesses, which can delay diagnosis and treatment. People with TB often feel very tired. This fatigue can be overwhelming and persistent, affecting daily activities and overall quality of life. If TB spreads beyond the lungs, other symptoms appear. This is known as extrapulmonary TB, and it can affect various parts of the body, including the kidney, spine, and brain. These can include swollen glands, body aches, and general discomfort. Swollen glands are often found in the neck and can be painful to touch, or pain in the joints. Joint pain can be severe and may limit movement, making it difficult to perform everyday tasks. Recognizing these symptoms early and seeking medical attention can significantly improve outcomes for those affected by TB. Tuberculosis, commonly known as TB, is a highly infectious disease that primarily affects the lungs. It spreads through the air. When a person with active TB coughs, speaks, or sings, they release tiny germs into the air. These germs are contained in small droplets that can travel through the air and be inhaled by others. These tiny germs, known as droplets, are the primary means by which TB spreads from one person to another. The droplets can remain suspended in the air for several hours, especially in enclosed spaces. If someone breathes in these droplets, they can become infected with TB. The bacteria then travel through the respiratory system and settle in the lungs, where they can begin to multiply. It's important to remember that TB doesn't spread through touch. You can't get TB by shaking hands, touching objects, or through other forms of casual contact. This means you can't get TB from kissing, sharing food, or casual contact like hugging or handshaking. The bacteria are not spread through saliva or physical touch. People with latent TB are not contagious. Latent TB means that the bacteria are present in the body but are inactive and not causing symptoms. They don't spread the bacteria to others because the bacteria are not active. However, they still carry the bacteria in their bodies. However, latent TB can become active TB if the immune system becomes weakened. This can happen due to various factors such as illness, malnutrition, or aging. This is why treatment for latent TB is important. By taking medication, people with latent TB can prevent the bacteria from becoming active and causing illness. Early treatment is crucial to control the spread of TB and protect public health. Section 4. Who is at risk? Anyone can get TB, but some people are more vulnerable. Smoking weakens the lungs. This makes it easier for TB to take hold. People with HIV/AIDS have weakened immune systems. They are at high risk of developing TB. Malnutrition and diabetes also increase the risk. A weakened immune system from any cause makes it harder to fight off TB. Living in crowded conditions increases the risk of exposure to TB bacteria. Section 5. Preventing the spread. Preventing TB involves a multi-pronged approach. Screening is crucial. This means testing people at higher risk to see if they have latent TB. Treating latent TB infections stops the progression to active disease. This prevents further spread. Vaccination is another important tool. The BCG vaccine is most effective in children. It protects against severe forms of TB. However, BCG is not always fully effective in preventing all types of TB. Section 6. Treatment and drug resistance. Treating TB requires a long course of antibiotics. This is because the bacteria that cause TB are very resilient and can hide in the body for a long time. The treatment aims to kill all the bacteria, including those that are dormant. Usually several antibiotics are used together. This combination therapy is essential to prevent the bacteria from developing resistance to any one drug. By using multiple antibiotics, we can attack the bacteria in different ways, making it harder for them to survive. This is to ensure that all the bacteria are killed. If even a few bacteria survive, they can multiply and cause the infection to come back. This is why it's so important to follow the treatment plan exactly as prescribed. The most common antibiotics for active TB are isoniazid, rifampin, ethambutol, and pyrazinamide. These drugs work together to kill the bacteria and prevent them from growing and spreading. Treatment must be taken for at least 6 months. This long duration is necessary to ensure that all the bacteria are killed, including those that are slow-growing or dormant. Missing doses or stopping treatment early can be very dangerous. Sometimes treatment needs to continue for longer. This can happen if the bacteria are particularly resistant or if the patient has a weakened immune system. In such cases, the doctor may extend the treatment duration to ensure that the infection is fully eradicated. It's crucial to complete the full course of treatment. Even if the patient starts to feel better, the bacteria may still be present in the body. Stopping treatment early can allow the bacteria to multiply and cause a relapse. Stopping treatment early can lead to a relapse. This means that the infection can come back, often more severe than before. The bacteria that survive may also become resistant to the antibiotics that were used. It can also lead to drug-resistant TB. Drug-resistant TB is a form of the disease that does not respond to the standard antibiotics. This makes it much harder to treat and requires more complex and expensive medications. Drug-resistant TB is much harder to treat. It requires a combination of stronger antibiotics, which can have more severe side effects. The treatment duration is also much longer, often lasting 18 months or more. It requires stronger antibiotics and longer treatment durations. Patients with drug-resistant TB need to be closely monitored to ensure that the treatment is working and to manage any side effects. This makes the treatment process more challenging and demanding for both patients and healthcare providers. Section 7. The global fight against TB. TB remains a significant global health threat. It's one of the top infectious killers worldwide. Millions of people get sick with TB each year. The heaviest burden of TB is in developing countries. Limited access to healthcare and poverty contribute to its spread. Efforts to control TB include improving detection, ensuring access to treatment, and developing new vaccines. Global cooperation is essential to eliminate TB as a public health threat.